Infection prevention and control in the home. Today we're going to review infection prevention and control practices that are very important in home care settings. Precautions that should be practiced will also be discussed. Home care patients may have risk factors that make them more susceptible to infections, and they may be immunocompromised, older persons, or they may have chronic illnesses such as diabetes, hypertension, and cardiovascular diseases, etc. Home care providers may include medical care, therapeutic care, other patient care, assistance with activities of daily living. All services provided in the comfort of their home and tailored to their needs. Home health versus home care services. Home health provides professional medical assistance, clinical medical supervision provided by a licensed professional, prescribed by a doctor, covered by private insurance. Home care offers non-clinical help such as meal prep and companionship, and this is not covered by insurance. So who benefits? With home health, seniors who were recently discharged from hospital, rehab, or nursing facility, seniors who need monitoring after a recent medication change, seniors who have fragile health that prevents them from going out to a doctor's office or are experiencing an overall decline in functioning and need therapy. For home care, those who benefit would be the seniors who need help with activities of daily living, such as bathing, seniors who are still active but require transportation to and from activities and medical appointments, those who need help with activities such as cooking, cleaning, and other household activities, and those who need companionship or feel isolated at home. Examples of home health: physical and occupational therapy, administration of prescription medications or shots, medical tests, monitoring of health status, and wound care. Examples of home care: companionship, reading, chatting, and in-home activities, transportation to appointments, assistance with activities of daily living like dressing, bathing, and grooming, meal preparation or delivery, cleaning and organizing, and help with bills or financial management. The home environment. The home environment can affect the care provided and the patient's overall quality of life. Plumbing, sanitation, and ventilation may be substandard or absent in the home. Regardless of the setting, safe and quality care should be delivered. The home environment is different from a healthcare facility. Hand hygiene. Hand washing is one of the most important measures in infection prevention. This practice should be carried out frequently to protect the patient as well as the caregiver. It is recommended that hands are washed after interaction with the patient, especially if the hands are visibly dirty. Hands should be washed before direct contact with the patient, before handling dressings or open wounds, and before handling patient medications. Hands should be washed after contact with blood, body fluids, open wounds, or mucous membranes, after contact with contaminated items, after removal of gloves, and after performing a procedure on a patient. Hand washing steps. Wet hands, then apply soap. Scrub hands for at least 20 seconds. Ensure that the palm of the hands, the back of the hands, between the fingers and under the nails are washed properly. Rinse hands until all of the soap is washed off. Dry hands with clean paper towel. Use the paper towel to turn off the water faucet and to open the door as you leave the restroom. The right way to wash your hands. Wet hands under running water. Apply soap and rub palms together. Spread the soap lather over the back of the hands. Make sure soap gets in between the fingers. Grip fingers on each hand. Make sure to clean thumbs. Press fingertips into palm of each hand and dry thoroughly with a clean paper towel. Personal protective equipment or PPE. This includes eye protection or goggles, face mask, gloves, and gowns. Gloves. Gloves should be worn during all contact with a patient, especially during patient care activities that involve exposure to blood and body fluid or non-intact skin. Gloves should be changed with each procedure and with each patient. Gloves are not to be reused. Hands are to be washed before you put them on and after you take them off. Face masks. Home care workers should wear surgical masks. Masks should cover the mouth and nose with minimal gaps. Avoid touching the mask while you have it on. Masks should be replaced when damp or dirty. Masks are for single use and are to be discarded after one use. Remove the mask from behind the head, not the front. Wash hands with soap and water or use alcohol-based hand sanitizer immediately after removing the mask. Gowns are identified as the second most used piece of PPEs. Gowns are protective apparel used to protect healthcare workers and patients from the transfer of microorganisms, body fluids, and particulate material. Gowns cover the torso and clothing, and they provide a physical barrier to the transfer of microorganisms and other materials. Eye protection is achieved by wearing eyewear designed to reduce the risk of mucous membrane of the eye being exposed to splashes of body fluid or flying debris. Examples are safety glasses, goggles, and face shields. Full face protection is achieved by wearing face shields. Conclusion. Home environment presents unique challenges to providing care, especially with infection prevention and control. Continued training and practices for infection prevention and control are very important. Infection prevention and control professionals support and guide home health care. Standardized guidelines for home health care are needed so patients can achieve optimal care.